is Dr. Misbah Khan. I wanted to show you another case where I treated facial asymmetries and skin laxity using my trademark technique called Mini SIF. This procedure is specifically related to fat injections and also fat grafting in combination with fractional lasers, mostly CO2. So I have another video that you can watch that goes into the detail a little bit more about the procedure of Mini SIF itself. And this is just another example of one of the patients that I treated. So let's just go through that. Here, okay, what does Mini SIF stand for? Mini meaning minimally invasive. S stands for stromal fat. That is basically depending upon what part of the body you're harvesting the fat from, and that actually is a very good question, but it depends upon where the fat is going. And so if you know the end product as to where the fat will be injected into, you can pick and choose as to what would be the best place to harvest the fat from, especially if you have a choice. If you don't have a choice, that's a different story, but you gotta just know where the fat is actually going to be ending up, and that's what will determine where you are going to have to borrow your fat from. I stands for injection. The injection solely, if it's going to be solely for the purpose of volumization, then all of these fat injections are done based on the golden ratio of the person's particular face, and that is 1:1.618. I have a golden ratio caliper that I sometimes use, and sometimes I would take photos of the patient in different positions and postures and whatnot, and then we can determine the golden ratio based on their frontal view profile and also side view profile. And sometimes patients, they are interested in a certain area more than the other, and so you gotta just have a little bit of a sense of where the fat is going to go, and then you can just have that discussion beforehand before you actually do the injections. And then F stands for fractionated lasers, mostly CO2 lasers, but I have a variety of different kinds of fractionated lasers, and many times I see myself using a combination of 1 or 2 and sometimes even 3 lasers. It depends. So here is the different areas where different applications of the Mini SIF, wherever you can think of, either it's facial rejuvenation or treating scars, or I use it for all these 3 areas, but I use my technique actually for a lot of other things as well, but those are the 3 main applications as to where my technique comes in very handy. And so let's just examine and evaluate this wonderful lady. So she's if you just sort of glance at her, then the first thing that comes to your mind is that there's just too much skin laxity, and that there's just a lot of signs of aging that are happening. But she would be a perfect candidate for a facelift. Yes, I 100% agree with you. But if the patient is not ready for a facelift, sometimes you have to make sure that the patient is mentally ready for a facelift. If she's not ready for a facelift, and if she's asking you for something that is short of a facelift, then I would go for this technique of Mini SIF that I would talk to you about. And the other options, there are other options. Yes, you could do fillers, you could do all of the other stuff, but fillers are not going to give you the result that your own fat can. Your own fat is so rich in your own stem cells that there is no filler in the world that can actually come even close to being able to do, or to be able to give you what your own fat can, if it's done properly. If it's not done properly, then you're screwed. But if it's done properly, then you can have a very good outcome. And number 2, fat looks very natural. So you don't have to worry about having all kinds of lumpiness or any kind of asymmetries and whatnot, and the filler creating any foreign body reactions into the face. If you do too much of it, that can happen too. But those are the problems that you can completely avoid if you do the fat grafting the right way. So she opted for fat grafting, and I was like, okay, I'm going to use my technique, and we'll also do some lasers, because you can see some acne scars here and there, and then there's some smoker's line on the upper lip as well. the lower eyelids are actually a little bit more hollow. They may appear like they have a lot of bags, but they have more hollowness than they have fat protrusion. So that's why I think that fat will actually be a good idea for her lower eyelids. So this is the patient for in my situation over here. And so the first thing, when I was going to take care of her, the first thing that I told her was, other than the fact that the skin is actually looking very sallow and very old and wrinkly, I have to address these jowls. Now, if I do not make the lower face appear a little bit more triangular, then the ratios for the rest of the face are all messed up, because it's all related to the patient's own facial structure and architecture. So I have to make the jawline as cool as I possibly can, as chiseled as I can. So the first thing that we had to do was to smooth out the jowls. And now after once I've taken care of that, then I have a face that I can work with. But until then, all of my ratios and my numbers are going to be completely off. And I did not want to go into a situation where I would be like, oh my God, sort of like an oh shit moment. Like, I don't want to do that. So the first thing was to actually make the lower face and make the jawline a little bit more chiseled. And so the first thing I did was that I actually did a little bit of a jawline sculpting. Here I am doing jowl liposuction. It's more like a liposculpting, and I chose to go with the manual because the size of the pocket is so small and the area being so sensitive. You're right above the mandibular nerve over here, so you have to be very careful not to be too aggressive. The pocket is very localized and it shouldn't take very long to actually smooth it out. This will be followed by laser resurfacing to ensure the skin tightening that the patient is here for. And I will be sharing the results of the patient procedure after all of this is done. But as you can see, small quantities of fat are so easy to sculpt and bring them out. This side is already done, and you can see how smooth the line came out, and we're still working on this side. So once the patient is complete, then we will post before and after photos. So once the jawline was all sculpted, as you can see, the results are visible while she's on the table. Here the area is marked, all of it. I had to make just like one teeny tiny incision, and from that incision I was able to sculpt the entire mid-neck and then also the sides, very, very tiny incisions. And then we were able to get it to this point, and look, already the jawline is beautiful now. So now we have a facial frame that we can work with, and now we can use our knowledge of phi and the golden ratio to recreate the entire face. And the second part of this whole process was to do her lasers, and which is what I did. And then once she had healed completely from that, then I had her come back and we did the fat injections. And so this is her, this is the way I have separated my fat, nano fat, and then micro fat. And then this is a slide that I've used in my other talks as well. That's just showing the macro fat, slightly larger size particle, which I did not have to use for this patient. That's just for show. But in this case, it was strictly based on the nano fat and also on the micro fat. And so here it is. This is our patient. The facial phi has been restored. So in her case, the fat injections were done all over the face in a very global fashion. Forehead. There is no Botox, by the way, involved over here. It's just strictly her own fat and lasers using my Mini SIF technique. So there is fat all over the forehead. Forehead rejuvenation has become very popular, actually. So I end up using a lot of fat for the forehead. Fillers do not necessarily look very good on the forehead. They tend to just like either migrate down, or they look very lumpy and they become visible. But fat, beautiful, always works. So anyway, there is a lot of fat over here in the forehead. I also injected fat in the upper eyelid a little bit, just to kind of make the eyelids look a little bit more youthful, even though she could use upper eyelid blepharoplasty, but at a later stage we will do that. The lower eyelids, as you can see, big difference. And I did not do any cutting on the lower eyelid. This is all strictly my technique of Mini SIF and nothing more than that. There's no filler, there's no Botox. Look at how gorgeous her cheeks came out. Very pretty, very healthy, and even the skin color got so much better from the first time. And that is the magic of fractionated CO2 lasers. When done properly, you can reverse so many signs of aging that it will blow your mind. But you just have to be careful when you're doing this procedure, because unless you really know what you're doing, you are going to screw up and it will not turn out to be good for you. But if you know what you're doing, and if you know the science behind it, if you know how to handle fat, if you know how to handle the beast so-called CO2 laser, you can have a very, very beautiful outcome. So here is my patient before and after, and I am very happy. The patient is also actually very, very happy. This will last her for a long time, and because this is her own fat, it will continue to regenerate the local tissue. It's so rich with stem cells, and the results are going to be lasting her for a very, very long time. So I hope you enjoyed the video. This was actually a great case of a patient who is not mentally or physically ready to undergo a facelift. And in the meantime, not only that I was able to reverse a lot of the signs of aging without having to cut her on any part of the head and neck, I also gave her a result that will last her for a very long period of time. Fat is laden with stem cells. It's the second richest source of stem cells that you can find and that you have access to besides the bone marrow. And then if you do have access to it, and if you can make good use of it, then wonders can happen. And the other big part of the whole technique of Mini SIF is the fractionated CO2 laser, and I've been working with the fractionated lasers for so long, and this is actually a game changer for me, just combining the two together and bringing the best of the both worlds from fat as well as from the lasers, and giving the patients the best outcome. What could be better than that, especially if it's non-surgical, and then there is very, very little downtime, if at all any.